Today, Jan and I, Lacey, are going to tell you about the benefits of doctors prescribing outdoor physical activity. Blasted on recent covers of Newsweek magazine are Fat for Life, 6 million kids are seriously overweight, what families can do, and when I grow up, I'm going to be 300 pounds. Help! The cover of a recent Fortune magazine states, Is fat the next tobacco? These are only a few of the many magazine covers and newspaper headlines of the last several years. According to the Center for Disease Control and Prevention in a 2009-2010 data brief, 35.7% of adults and 17% of children in the United States were considered obese. Part of the problem is that most Americans are not active in their leisure time and don't seek means of activity in their day-to-day life. The percentage of adults who spend most of their day sitting increased from 36.8% in 2000 to 39.9% in 2005. A 2011 CDC survey indicates that 13.8% of children in the United States did not participate in any physical activity for at least 60 minutes on any given day. The CDC also notes that only 25% of American adults engage in recommended levels of physical activity, and 29% engage in no leisure time physical activity at all. Studies have shown that when people have access to parks, they exercise more. The idea that parks play an important role in the promotion of healthy and active lifestyles was noted in the mid 1800s by Frederick Law Olmsted, the father of North American urban parks. Dr. Miller, a family physician affiliated with the University of California, San Francisco, calls the lack of physical activity and the disconnect with natural environment a disease of indoor living.
Recently, there's a new movement between the healthcare system and the public lands across the country. This movement, entitled Park Prescription, is where a growing number of doctors have begun writing prescriptions for physical activity outdoors, and they use parks to accomplish this. And the potential of the parks as important community settings for physical activity is highlighted in both conceptual and empirical research, according to the studies by Bedamo, Rung, Moen, and Cohen in 2005. This idea was born with physicians, health insurers, naturalists, government agencies, all joining together to promote nature and wellness. This first script is for a prescription trials program in New Mexico, is being given by participating doctors in the program to their patients. And the second script, entitled RX for Outdoor Activity, that is also given to patients by the participating doctors in their program. And it is from the Children in Nature Initiative, and it is partnered along with the U.S. Fish and Wildlife Service and also the U.S. Forest Service. Here are some organizations that are involved in initiatives to promote the park prescription. There are a few of them I'm going to mention, and Lacey will mention some also. One of them I wanted to pinpoint was Let's Move Outside. That's the one that's spearheaded by Michelle Obama, and that's trying to promote kids being more active outside, get them outside playing rather than being inside with video games and watching television. I know some people have probably heard about that. And there's also a movement for healthy parks, healthy people, and that is sponsored by the national parks. And then, of course, there's the exercise as medicine movement that is promoted by the ACSM. And these are all organizations involved with the park prescription, that these programs, they might be a little bit different, but they're all, their goal is to promote outdoors and moving for better health. Now Lacey's going to describe another organization called My Big Green Gym.
My Big Green Gym is a Blue Cross Blue Shield program focused on helping families and individuals throughout Michigan improve their physical, spiritual, and mental health by taking workouts outdoors. BCBS, Blue Cross Blue Shield, MRPA, the Michigan Recreation Parks Association, and the DNR, the Department of Natural Resources, have teamed up for this program. This program encourages Michigan residents to take advantage of the state's 101 state parks, and hundreds of other community recreation agencies that offer a wide variety of physical activity. Beginning April 2013, Grand Traverse, Kalamazoo, and Marquette counties will be competing in the inaugural My Big Green Gym Community Challenge. Participating community members will log their physical activity in times and miles. Upon completion of the challenge in July 2013, Blue Cross Blue Shield will award grants to all three participating communities. The largest grant will be awarded to the community with the most active participation. The grant will be used to support public health and wellness investments in the community.
Some examples of physical health benefits include findings from a Cleveland study of park use by older adults. And the findings show that the people that are active in parks, they're less likely to become overweight or obese than those whose park activities were passive, such as sitting on park benches or no park visits at all. There's other examples that include lower blood pressure in active park users, and annual medical costs were lower with active park users. There's other benefits too that include better air quality outdoors. That is due to trees and other vegetation that filter harmful air pollutants in the ozone, thereby lowering respiratory diseases such as asthma. And cancer risks are lower because the toxic pollutants in the air are lower because of the trees also.